My name is Pat Iyer, and this is Legal Nurse Podcast. You're going to have an opportunity to hear from Allison Dickson in a moment. Allison is an emergency department nurse with experience in quality improvement case review, which she is now applying to her legal nurse consulting practice. Allison and I just finished a podcast, and I will now ask Allison, what were some of the key things that we talked about?
Some of the key things we discussed were emergency department throughput, misdiagnosis, and treatment in the emergency department, and things that can go wrong.
One of the things that I believe you'll get from listening to Allison's podcast is the sense of the stress associated with working in an emergency department and being a patient in an emergency department. The long waits for diagnostic test results, the long waits for treatment rooms, the anxiety and the stress that the patients experience while they are in the waiting area. They're uncomfortable, they're in pain, they want attention, and the attention is limited. And yet, at the same time, the ER is focused on getting those patients in and out as quickly as possible. And that doesn't always happen. So we'll explore those issues in the podcast with Allison Dickson. Be sure to watch your podcast to get some tips that will help you in evaluating emergency department cases. Thanks so much. Be sure to get Allison Dickson's podcast next.